So First Nations control, in part, some of their healthcare delivery in British Columbia. So we're being asked to transform the system so that it can be more responsive and more helpful to First Nations people. So we've been looking at a model called Primary Healthcare Plus, where we're trying to look at current primary care services and then enrich them, adapt them, because our needs are unique. And we've been involved in something called the Telehealth Expansion project. The Telehealth Expansion project was initially very technology focused, really laying cable so that remote communities had capacity to receive data that was being transmitted from urban centers. But communities were clear with us that they wanted a two-way conversation and that their care was much more than simply placing a machine or a cable near their homes. And so we endeavored to speak to communities through quite a long process starting in 2007 to ask them what they needed. First Nations said that they wanted to have the input into how they interacted with us, and we called this cultural safety and humility. And we tried to sharpen processes around, for instance, the referral process, scheduling, registration, pre-appointment activities, active and post-telehealth events, and integration of all health activities within the community. Community members now have a real choice in what care they access, how it's delivered, and with whom they build those meaningful wellness relationships, and that there's increased community engagement and capacity that's been built through the sharing of knowledge and by empowering communities to transform their own systems.